of my orthopedic colleagues who refers a lot of patients, and it was for electrodiagnostic testing for nerve tests of his hands because he was worried about weakness. She was a patient right before lunch, and it was not great. And she has Parkinson's disease listed in her problem list. And I was like, this is annoying. Why is he sending me her? If she has Parkinson's disease, she has a neurologist, and this should be their job. And he sends me too many tests. He should have sent her to that guy, not knowing who the neurology person was. And so I read his note, and his note is like, the patient's hands have a lot of atrophy. This is motor neuron disease or some kind of severe motor neuropathy. I was like, what? That's a strange diagnosis for an ortho hand guy to make. So I walk in the room and looked at her hands, and I'm like, she probably has motor neuron disease because her hands had so much atrophy. So I examine her, and she's got fasciculations, which is little twitching muscle movements in all four limbs, and also fasciculations in her tongue. And she's got neck flexor weakness and neck extensor weakness and quadriparesis, which is weakness in her whole body. A lot of weakness. And she could barely walk. She complained that she could barely walk, but I could overcome her hip flexors with 2 fingers, and I was able to overcome her hip extensors with 2 fingers, meaning she's profoundly weak in the lower extremities. She had bifacial weakness, and she had respiratory weakness. She had mild dementia, and her son was there, and I asked him, does she get really confused when she wakes up in the morning? And he's like, oh yeah, she's confused when she wakes up in the morning, which is important in people with motor neuron disease because it means that their respiratory function is compromised at night and they're getting CO2 retention. And you ask people that because you can hear their weakness in their voice. This was a very obvious case of motor neuron disease to the orthopedic hand surgeon, and I did nerve testing on her, and I told them, I think, you've got motor neuron disease, and I did blood tests and MRI of the cervical spine, which honestly I don't think was necessary because she had tongue fasciculations, but I always do them, and I referred her to the muscular dystrophy clinic, to the multidisciplinary group that does ALS in town, and I've never seen a wrong diagnosis of Parkinson's disease and thought a lot about it. I've been thinking about it for a while. This is a catastrophically wrong diagnosis, and the only thing I can think of, the only way I can put it together in my mind is I don't think he did a very good motor exam.